Yes, hi, good evening. Thank you, Dr. Gloria. Can you please, you just mentioned about being unable to contact some people through contact tracing. Is there a protocol in place when there might be a potential case in an FCPS building? Do you go to that building and talk to the administrator?
Please repeat. You mean
I'm asking if you mentioned that you're not able to reach some people in contact tracing because some people just don't pick up their phone. If there's a potential, if someone has a case in an FCPS building and they haven't been reached out, I mean, are you reaching out to the building administrator to say, hey, I've got to talk to these FCPS staff pronto? And I ask because I've heard of a case where this has happened. So, you know, the FCPS staff wasn't contacted. So what I'm asking is if you don't hear from people for FCPS, right, we're different than the general public, is there a protocol in place where if you are reaching out to the FCPS staff, are you also reaching out to the administrator of the building to say, hey, we're going to be contacting your staff. We haven't heard from them, you know, get us in touch, please.
So we use our, what do you call it, our school health aides and nurses to help us connect with FCPS. So I'll be interested to find out a little bit more about that individual example that you used, because it's worked very well. We're very responsive and we connect.
Okay.
So I don't know what happened in that case.
Sure, thank you. Yeah, that'd be great to follow up with that. We can get that to you. So let me just please check my understanding. So you're saying that with the 5 mitigation strategies in place, we can, as a division, keep ourselves safe, you know, per school. And you've cited the success that you've seen in your health agency and building up that, you know, comfort, like the flight attendants. But then you also said where you have seen exchanges, it's employee to employee. So what I'm trying to reconcile is like, I really want to accept your guidance that says, hey, we can be safe to do it. You guys just haven't experienced it yet enough to get it. But it feels to me, it sounds like you're talking about our schools as if they're this closed environment where the kids, once they leave, they're interacting with other adults and other people that then they get exposed and they come in. So is that my understanding? What you're saying is I don't know if you're recommending, if that's the right word, but you would say that FCPS should go forward, bring kids back as planned with a hybrid model, keep the 5 mitigation strategies, and you're saying that data is showing that it's not expected that transmission would ensue? Is that correct?
It is not automatic. Transmission will ensue. Transmission will ensue if those 5 mitigation strategies are not adhered to consistently and correctly. And I believe a previous slide that was shown, maybe in your previous meeting, CDC has, again, 5 categories: lowest risk of transmission in schools.
Yeah, but well, excuse me, Dr. Gloria, but what I don't understand is it sounds like you're telling us that as long as everyone stays in this bubble of a building, it's okay. But what about the fact that all these people go back to their homes? And, you know, I love your high aspiration that people all do these mitigation strategies, but it doesn't happen. I'm glad your staff is on it, but not everyone is up to par. And it's just human nature. So, you know, even if all of our staff and students were, they could go out and be exposed to someone who isn't. So I get that. To me brings me right back to the risk aversion. And to date, this board has not felt comfortable as a whole saying, it seems to me, that we're willing to risk one life. So, and I asked you this question months ago. So I'm just trying to, again, trying to confirm my understanding.
You can finish your thought.
Yeah, I don't know if it,
I hear you.
I don't know.
Would you rather follow up directly?
Excuse me?
Would you rather follow up with them?
I think this is a critical thing. I mean, if that's her recommendation, we need to be clear that that's what she's saying.
What I'm saying is that those mitigation measures, the guidance, it's to be used everywhere. That's what we should be doing in our private lives and in our professional lives. However, in our private lives, there's nobody to really police what we do in our private lives. But in the FCPS setting, in FCPS schools, people who are within the four walls of an FCPS building, these mitigation strategies can be protocols put in place to ensure that they are adhered to as best as possibly can. And so the teams that go around and will do spot checks on whatever will be bringing to attention of FCPS leadership which areas of the mitigation strategies are not being adhered to so that correction can be made.
Yeah, and I heard my bell for my time, but can I ask?
That was I gave you the latitude there, Ms. Meren.
Yeah, I'm just wondering if Dr. Gloria, you've been to one of our schools that has been doing in-person learning since September.
No, I have not.
All right, thank you, Ms. Meren. Up next, we have